It's time for Focus Forward, sponsored by Invest Grand Bahama. It's Grand Bahama's best talk show, highlighting all of the positive things happening in Freeport.
Look forward to our special guests each week that will tell you about events, activities, and initiatives that are making a remarkable impact on our community.
You'll also hear from local business owners and get a heads up on deals and special promotions. It's time to Focus Forward. Hello everyone and welcome to Focus Forward. We are so delighted to have you here with us today. My name is Glendia and Alex, Manager of Quality Assurance and Special Projects at the Grand Bahama Port Authority, and I am joined by my co-host, Alex Thompson, who is the Director of Public Affairs at the Downtown Freeport Business Association and a business owner in downtown Freeport. And if you listen to her, you would think that downtown is the only place in Freeport, but we have other places. Hi, Alex. How are you?
I'm good. I like you this morning. I like it.
You like anything that talks about downtown?
Anything that talks about downtown. You walked downtown lately. I know your
I
office
walk
is in downtown.
all the time.
Have you seen the number of businesses that have opened up downtown?
Of course.
Okay. Just want to make sure you know. And
Yes.
y'all need to know. That's why you need to tune in to Focus Forward every single Thursday.
To know what's happening.
To know what's happening, and especially to know what's happening downtown.
Not only in downtown. Well, you know what happened in downtown not so long ago? The 70th anniversary, the Junkanoo.
You wasn't rushing, though.
Well, I was organizing with the committee.
You
So I was
the
doing the
road.
work.
You need
I
to be
was
on
doing
the
work.
road.
I can't always be on the road,
You got
Alex.
to be on the road.
I will leave that for her. She likes to be on the road. Literally.
All the road. Beat the road. Beat the road. Tear up the road, they say. It was a good time, though.
You had a great time?
It was a good time. It was a good time.
It was a wonderful event,
Yes.
and we want to thank all of those Sean Canoe groups that would have participated. 5 of them. Swingers rushed in the rain.
You biased it.
You know, I am a Platinum Nights girl, I just got to say. But swingers rushed in the rain. They did a
Who won?
fantastic job. They look so good.
Who won?
The swingers.
Okay.
Yeah, I'm just saying,
Okay.
but you know,
So-
but they all did exceptionally well.
bragging
And so
rights.
we had a wonderful, wonderful time being able to celebrate the birthday of Freeport. So people are saying it's the birthday of the
70
Grand
years.
Bahama Port Authority, and yes, that's a part of the 70th anniversary.
But
the main deal is it's Freeport's
Freeport.
birthday, so we
Yes.
get to celebrate us being here. 70 years is a long time.
We look good for 70, though.
Milestone, that's 310, and we still here.
Okay, but we
Okay
look-
then,
we look
and we
good, though.
going. Yeah, we do.
Yeah, we took a licking and keep on ticking.
All the time.
So y'all need to move to Freeport. That's what's happening. Listen, to find out what's going on in the city of Freeport all the time, tune in to Focus Forward. Visit the GBPA YouTube. Visit us on Facebook, Empowering Licensees, Invest Grand Bahama Small Business Bureau.
Yep.
And you'll be able to see where you can find us always on Thursdays on Facebook. You can find us on ZNS as well, and other radio stations and TV stations.
Absolutely. Definitely get all of that information from the social media. We are, like Alex would say, everywhere.
Everywhere.
So
We
make
are.
sure that you share this information with others so that they will know what's happening within the city of Freeport. And so we continue to observe cancer awareness.
Did you not
And
notice?
of course,
Did you not notice?
yes, you still have on
Okay.
your nice pink. You still
Okay.
have on your nice pink.
My little pink thing I
Good for
got
you.
from our
That
guests.
you got from our guests.
And my bracelet.
Wonderful. I have on my little
I like
bracelet.
them.
Yeah. Very, very nice. We appreciate that. So we continue to celebrate, observe Cancer Awareness Month. And of course, we have to talk to all of the people that can bring us the necessary education and information that we need. I think sometimes we take for granted that we do have persons within our community that can really, really help us. They can educate us. They can get us to be the most informed when it comes to certain topics. But if you don't engage them, they're constantly working. But now we need to bring them around the round table,
Pull
because
them out
this
of
is
their
where
offices.
we begin to learn and grow. And so I think that's the most important thing. And so, you know, this is a time when we have to come together, and we also have to honor our fighters, right? Those would have gone through cancer. We spoke with Ms. Simmons
Yes.
in our last show, and then of course we want to
Such an inspiring
celebrate the
story.
survivors.
Yeah, such
we
an
want to
inspiring
celebrate
story,
them.
yeah.
And we also want to remember those who we would have lost, loved
Right.
ones. And so this is the time that we do that. And again, we want to work into the education and ways that we can look at early detection.
Champion
and
the
those kinds
call,
of things.
early detection.
Absolutely.
I say Ms. Simmons' story is ideal because she had said she waited for detecting the first time, and she turned out to be stage 3. But the first time, the second time, she went right away. Early detection.
Yes.
We're going to sing that through this whole series.
Really, really important. So at this time, we wish to welcome to the show for the very first time with us, Dr. Saida Bowe, who's the head of Department for Obstetrics and Gynecology and an oncologist consultant.
Yes.
Thank you for being with us.
Thank you for having me.
Now, we really want to get into this conversation with you because when we talk about Breast Cancer Awareness Month, of course, we know that there are several different cancers, although we talk about breast cancer most of the time. What message do you want to share with women and men about the importance of early screening?
So the importance of early screening is early detection, which means an early stage, which allows for longer survival. The unfortunate thing that we have here in the Bahamas is that everybody buries their head in the sand, right? And a woman may find a lump in her breast and say, oh, it's nothing, and just explain it away with something, because there's a fear of having a mammogram. Yes, it is painful, and it's not unbearably painful. It is a bit of a discomfort to have a mammogram, but a mammogram can pick up a lesion that is less than 1 centimeter.
Less than 1 centimeter.
That there is the biggest thing with why you should have a mammogram done, because it will allow for early detection. Having a mammogram when you have something that is palpable, while yes, it is done, you probably need a biopsy more than anything else, because at this point, we need to know, is it cancer or is it not cancer? So early detection and knowing your family history. So if you know that your mother had breast cancer, then you should be somebody looking to get screened earlier than when she was diagnosed with breast cancer.
What would you say is earlier?
So if your mother was diagnosed with breast cancer, say in her 40s, then you should be looking to get screened in your 30s.
Really?
As opposed to waiting until you're 35, 40. So in the Bahamas, because of our high breast cancer statistics, we do most times recommend that women have their first screening done at the age of 35 so that we can diagnose you earlier, because there are women being diagnosed with breast cancer in their 20s, unfortunately.
So I have a question then. Before, I don't think in the past, we never had the conversation about going to get screened in your 30s.
Because of now, we're looking at the numbers, right? And the numbers are showing that, yes, we need to get these women much earlier. So if it is that you have, a family history, or you have that lump that's in your breast and you're in your 30s, yes, go ahead, go to your doctor and get screened, right? And again, as an oncologist, I always encourage all of my patients, whether you're coming to see me because of oncology or not, that you should do your annual physical. Women should be seen by their doctor at least once a year. Make it your birthday present to yourself. So anybody who has ever heard me present will always say that that's my signature statement, right? Make it your birthday present to yourself. Get your annual physical at your birthday.
At 1 centimeter, is that something that I can feel in my breast? Or
No.
Okay.
So if you can't feel it, right? So I used to have a keychain that had the different sizes that you can feel, that your provider can feel, right? And so the size of a lump that a mammogram can detect is considered to be the size of a US 10-cent piece.
Really?
Wow.
The size that you should be able to pick up would be that of the size of a US 5-cent piece. Your doctor, a 25-cent piece.
Oh, early detection is key. Exactly. I thank you for that. You break that down very
So
easy. The fact that we
when
don't
you're
know.
now looking at the size of the different coins, a 10-cent versus a 5-cent versus a 25-cent, it's significant, right?
It is significant. I didn't think about that. When you said 1 centimeter, it made me think, okay,
How big is 1
how
centimeter,
big is
right?
1 centimeter?
Yes.
So, and the fact that you said that the mammogram can detect it, and early detection
It's key.
is key, so we can cure it.
So what are some of the other signs? We're talking about the lumps and what could be felt at different stages, or depending on whether you're having a test done or a mammogram done and otherwise. What are some of the other signs or symptoms that persons can look for that they may not know about if in fact they are going through something that could become cancer?
So the unfortunate thing with breast cancer is that most of the signs and symptoms that persons have indicates a late stage of the breast cancer disease, right? You may have a nipple discharge, but again, that does not mean that it is an early stage. That could very well mean that you have a late stage. There is nipple changes that occur, there is skin changes, but when you have those skin and nipple changes, that's late stage disease, right? We call it a peau d'orange, and that's a late stage of the disease when it's that way, because now there's skin changes that, because it's now puckered the skin over it.
Why do you think women don't come in?
Fear. So we need to get over the fear, right? Because my cousin, my aunt had a mammogram and they told me that it was painful. And because of them saying that it was painful, I'm not going to do it. But there are things that persons told you that you still tried, right?
Right.
There's some alcohols that you drink that people will be like, oh, that tastes awful, but you still drink it.
Because you want to have your own experience.
Exactly.
And determine whether or not you like it or
So
not.
Right.
have your own experience when it comes to a mammogram, because it can very well save your life, right?
I like
and
that.
with such a high cancer burden in this country, I think we need to take our heads out of the sand and get screened. You know, you have so many different organizations that are offering free screening because they understand the importance of us diagnosing breast cancer at an earlier stage.
Now, I used to think small breast women did not
Get breast cancer.
get breast cancer. I thought that.
Men
'cause
get breast cancer too.
Most of the women I knew who had breast cancer had voluptuous breasts.
No.
But that's a misconception.
It is, because men get breast cancer too, and they don't have breasts, but they have breast tissue.
Interesting.
Now, what are some of the other misconceptions then that may come across your desk based on your experience? What are some of the things people believe that are just not true?
What are some of the things that people
And while
believe?
she's thinking about that, I just want to
Yeah.
say, I did have a mammogram done. My very first mammogram was a good experience. I was afraid when I went, but the person that would have done the test for me was so gentle, even with the machine. I wouldn't talk about the second time, but the first time, the first time was, but the second time, even though it wasn't as easy to go through, the second time the technician was explaining certain things to me, some of the changes that happen, you know, with your body within your breast and that sort of thing that may make it a little different. I just think that person was just having a rough day and trying to get through everybody. But the experience, the very first experience, was very gentle, and I believe it can be done very gentle, and so something to consider as well.
So to answer that point, it could be also where you are in your menstrual cycle, right? So women know that your breasts tend to be a bit more tender right before your menses. So it could be maybe the second time you were close to having a menstruation, and so that's why it may have been a little bit more painful. Just saying, not saying that there may have not been something with the technician.
Yeah.
But that can also sometimes
That can be
cause you
something.
to have a little bit more pain. Now, another misconception is that when you have a mammogram, it causes you to get cancer. That is not true. The amount of radiation that you get from having a mammogram is very, very negligible. It does not cause you to get breast cancer. I've heard that many times, because persons will say, oh, but my aunt had a mammogram and she got breast cancer from the mammogram. No, your aunt had breast cancer. The mammogram diagnosed her breast cancer.
Okay. So why do you think we have, is there statistics do we have to show why we have such a high rate of breast cancer or cancers in the Bahamas?
So there's been several studies done, right? The first one was done by University of Miami along with Dr. Curling, Dr. Turnquest out of Nassau, and they were looking at the BRCA or BRCA mutation gene, and we have a very high rate of that gene within our population. Now, while it was at the time a very small study, right, but we have a 25% mutation rate within our country. What does that mean?
I was going to ask
Yes,
you.
that was my next
break
question.
Break that down
Yes.
for me.
So this BRCA gene mutation, it is, back to genetics, it is autosomal dominant, right? Meaning that one parent, once one parent has it, you can pass it on to your children.
Okay.
Okay, so if you have that your mother had breast cancer, then there is a 50% chance that you may have that gene because your mother had breast cancer. If your father has the mutation, he may not have breast cancer, but there's other cancers that are related to that BRCA mutation. And so he may have the gene and then be able to pass it on to his children. So again, this is where we as Bahamians need to start having more conversations about our health, right? And engage your children and let your children know that this is a diagnosis that you have, and not try to keep it from them and bury, again, your head in the sand and say, oh, they're too young, they don't need to know. They need to know. They need to know your medical history so that they can then, when they get older, make informed decisions as adults regarding their medical journey. Because if you now have the BRCA mutation, right, at a young age, you can decide to do some risk-reducing surgeries because you have the mutation. And going back to that study that they did, they actually found what they call founder mutations that were unique to the Bahamas, right?
Really?
So we have a mutation that is only specific to the Bahamas that they've not found in other populations, right? So when you read the medical literature, they talk about the Ashkenazi Jews as having the highest breast cancer rate, right? But our number is 25%, which is a little bit higher than theirs, which is at, I think, 22 or 23%. So again, while a small study, it's still a high number. And there have been, most recently, just last year, the group, again, out of University of Miami, along with a group from Fox Chase in Philadelphia, they again came back and were doing some studies looking at persons with breast cancer and looking, prostate and breast cancer, sorry, looking again now at if there are any other mutations that we may have within the Bahamas. So we're awaiting the results of those, and they specifically at that time just tested persons that have a diagnosis of cancer. So they did the tissue along with their blood testing.
This is good information.
Now, speaking about studies then, have there been any recent studies or anything that in the medical community persons are looking at in terms of new treatments or something else that can be used, anything of that nature?
So every day they're finding new treatments, new treatment options. The only factor is, unfortunately, cost, right? Because one, there's a cost associated with doing the test, and two, then there's a cost associated with the treatments. But yes, there are new treatments that are available. For breast cancer, it's now considered standard of care to have what we call your status testing, right? So looking to see whether or not the cancer is ER, PR, or HER2 negative, positive, because then that can help with deciding what are your treatment options available to that woman. Again, you also look at whether or not it is BRCA mutation, because then there are medications available that can help with that. So we do have those resources available. Sometimes they're available only within the private sector, unfortunately.
Because everything, it has its cost.
A significant cost.
And I was about to ask, how do you think the health community can improve having access to some of this stuff?
That may lead to the fear, though, because the thought is, if I'm diagnosed, I cannot afford the treatment.
So that is one way of looking at it. But again, I go back to, if you know that you have this, then it can help your children, right? So it may not be of benefit to you because of the fear of the cost, or the cost associated with it may be cost prohibitive, but it is still something to know, right? Now, in terms of the knowing whether or not it's ER, PR, or HER2 receptor positive or negative, I know at one time the pharmaceutical companies had offered, and they were doing it free of charge, right, for persons within the public health system, because they wanted to know what are the numbers. And again, they were also doing the BRCA testing, and we were able to get a few of them for patients with ovarian cancers, where they were offering the test for free. Now, obviously, the drug isn't for free.
Right.
We don't have at this time compassionate programs like the US or Canada have, where if you have a patient that has the disease and needs this drug, sometimes you can write to the pharmaceutical company and get the drug for free or at a reduced rate for that patient. But we don't have that. But they were, like I said, offering the testing free of charge at one point when they were getting the numbers as to how many persons we have with these different things.
So again, I'm hearing it's all about the education. It's all about getting the knowledge. And I would say to you, this information about finding out from your family, not until I decided to revisit my health insurance, not health, my life insurance, did I realize that I could no longer increase my life insurance. Because when they asked me to fill in the form and find out about what's your family history, I'm like, well, I didn't do this when I first signed up. Well, the world has changed. And so we're not able to increase your policy anymore because now you are at a high risk. And I realized that we don't talk about this, and I didn't think about this. I didn't think about asking my mother about it, even asking my father about it. What is the history? Like, how many of your siblings have had cancer or diabetes? Things that I didn't know. And I realized we don't talk about it.
No.
We do not at all.
We don't, and I wouldn't say a pet peeve, but something that we need to work on, whether it is legislatively or how we're going to work it out, is yes, I'm asking for persons to know if they have a BRCA mutation or not, right? But the insurance companies can use that sometimes against you in a negative way. And that really and truly should not happen, because if somebody knows that they have the mutation and then they go ahead and do some risk-reducing surgery, that I think is of benefit to the insurance company, as opposed to them not knowing and then being diagnosed at a late stage with a cancer, and then that's costing them more money. But again, it is something to have the conversation with the legislative parties along with the insurance companies about, not penalizing, not penalizing a patient because they have been diagnosed with a BRCA mutation.
The whole purpose of going to the insurance company is to get insurance.
Right.
In case something happens.
Yes.
Just like, whether it's health or medical. And so to be turned down is really, that was eye-opening for me.
Yes.
Dramatically, like, I can't believe it.
For sure. So as an oncologist, in your experience, what has it been like to work with patients and support them emotionally where possible? We're all human, right?
Yes.
So I just want to know from the doctor's perspective, what is that like?
As the provider, it has its moments, right? There's always the joy when you can see a patient and know that they're doing well. They were caught at an early stage. The information is getting out there. That's always a plus. That's always something that I enjoy seeing. And then, yes, there is the, what are goals for you? What are things that you want in terms of, okay, what can you not tolerate? Do you not want to have pain coming down to the end? What do you want to maintain? Do you want to maintain your independence? All of those are conversations that we need to have. We don't have the support in terms of the emotional support. You try to provide it as much as possible, allow them the opportunity to talk and share with you whatever is going on. But as a group, no, there is no that additional support necessary for patients.
Okay. Well, Dr. Bowe, thank you so much for joining us today and sharing such valuable information. I believe out of all of the years we would have been doing this show, we've never had someone so open with new information, talking about some of the studies and some of the things that we otherwise would not know. So thank you for being able to share that with us. And of course, we look forward to having you again with whatever happens with additional studies and what's going on in the medical community. And certainly everybody that's watching is so excited to be able to hear some of these things, because otherwise, unless you're reading, studying, and most of the time we don't understand the jargon, right? But this is a good way to learn about these things. And so as we move forward, you know, we're very, very happy having had you today.
Thank you for having
so
me.
much.
All right. So we have so much more coming for you. Of course, we are observing Breast Cancer Awareness Month and cancer awareness.
Right.
And so we want to be able to continue to educate you. And so we have so much more information to come. Please don't go anywhere. You don't need to get a drink. You don't need to do anything. Just stay right there. We'll be right back.
Right after this.
Hello, welcome to P & Roy, a Bahamian design and Bahamian-owned company. You can find your latest fashions and trends for men and women. If you have a special event, such as a beach outing, such as a wedding, an evening out on the town, you can find that special outfit. You can also find special outfit for his and hers as well, even the little children. We also have overnight bags and evening gowns and dresses. We also have men's suits. We have men's shorts. We are located in Port Lucaya Marketplace. You can find us on Instagram and Facebook. So come on down, we're waiting on you.
Welcome to Freeport, the reawakened, the reimagined, the rebirth, the Renaissance capital of the Bahamas. Over $1.5 billion in investments. Marinas, cruise ports, downtown revitalization, residential developments. We're putting the city on the map. Want to know more? Just log on. Your future is only a click away.
Welcome back. We're here on Focus Forward having a wonderful day today. And of course, we are talking about the observance of Cancer Awareness Month, Breast Cancer Awareness Month. But of course, we want to look at cancer as a whole, and we've been educating and sharing information, bringing all of the right people to the table to be able to let you know everything that can help you, or perhaps something that you can learn that you can use to help someone else, so that we can all be aware. And of course, we've been talking about what, Alex? The number one thing?
Donate. Early detection. but
Early
donate.
detection. Okay.
Donate.
Both, yes.
And early detection.
Okay.
I must say though, the last week's show and this show, the information that's being provided, I think has been the most informative over the years that we've been doing this show. So I'm thankful
Absolutely.
that we do the show every October, but I'm also thankful that the people that we have on the show are sharing information that we need to get out. We talked with Dr. Swan on our last show about the mental health.
Yes.
We talked to Ms. Simmons about her journey and what that means to be more sensitive. We talked with Dr. Bowe on the first half of this show, where she talked about how the fear, of finding out and knowing, and also about finding out your family history, which a lot of people don't think about. We just don't talk about it. I think we have a society where we just don't talk about anything that's wrong.
Because we think we can handle everything, so we just do it.
We just
do it. And it's not always the right thing.
Glendia,
Yes.
I need to tell you.
Okay, tell me what.
I need you to know that I really like food. That's something about
She
me you need to
literally
know.
scared me just now. I'm wondering what's happening.
But, see, but this is it.
Did we
need to
just
be able
cut?
to- we need to-
What's happening?
We need to be able to talk to people about
Right.
things that we know, or we don't know,
Right.
and have that question. I mean, have you spoken to your mother about your family history?
So I have.
Okay.
We've had that discussion. My mom and I have a very open relationship. We talk a lot. It's like one of my best friends.
So that was
So we
not
talk
triggered
about
by
those
any type
things.
of medical problem, or we just talked about it.
So we talked about it because I had an aunt that was impacted by cancer.
Okay.
And so just having that discussion to find out, is this really something? Has this happened before? Where did this come from? That kind of thing.
Right.
It was triggered by something, but it still was a very open discussion. And that also opened the door for other things. As females, there are a lot of things that we don't talk about.
Very true.
Right? And so that opened the door for a lot of other things. So we've had the discussion, and then I guess the encouragement that we've been hearing from the persons that would have joined us to be interviewed, we need to have those discussions. You have to talk about it.
So it's just talk.
Talk. Get it open. Get it out in the air.
So you like to make noise that I talk too much, but obviously people need to talk more, like me.
Not Alex, but okay. But we want to get into our conversation for this portion of the show. We are excited to welcome to the roundtable Dr. Letitia McIntosh from St. Thomas Medical Center. Hold on. I had someone share with me another title. I believe you are a director, if I'm not mistaken. Yes. So I just want to make sure that I highlight that from St. Thomas Medical Center. And she is also an entrepreneur, Alex. Right?
Yeah. St. Thomas is located where?
From
the 17th Center.
Right.
Downtown.
Near to you.
I just wanted to make sure we got that clear.
But also, she's an entrepreneur for Whisk and Roll Bakery and Cafe.
Whisk.
It's wonderful. So we want to have both discussions with you today because I'm quite sure there's a lot that you'd be able to share with us, and we appreciate having you here with us today.
Thank you.
All right, and also we want to welcome, not for the first time. Is this the first time?
Is it the first time you've been on the show?
It is the
yeah,
first
it's the first
time.
time you've been
Really?
to our
He
oval
reminds
table.
me. No, he reminds me of, I believe, another entrepreneur that we would have had on the show.
Okay.
In the Seahorse Plaza, if I'm not mistaken.
The fitness.
Is it
The
Phoenix?
fitness.
yeah.
Yes,
yeah. Okay.
someone that came from there. But we have Mr. McDonald, Jean-Louis, founder of Sacred and Fit, and he's been all over social media all the time.
Yes.
And so it's very, it's a good day when we can have you come and talk to us
Thank you.
about wellness. So thank you so much for being here.
Thanks for having me. I
Wellness.
appreciate it.
I like that wellness, not just
Yes.
weight loss, not just what not to
Not
eat, but
wellness.
wellness.
The
Overall
wellness.
Overall wellness. That's what his shirt says.
Yeah.
Sacred and fit, mind, body,
Body and
and
soul.
spirit.
And spirit.
Yeah.
Okay.
Okay, so let's talk with Dr. McIntosh first. You wear two very different hats as a healthcare provider and also as an entrepreneur. How do you balance those roles?
Well, I am an emergency medicine physician. And I've been practicing medicine for the past 25 years. I absolutely enjoy the practice of medicine.
25 years, I'm not going to lie. You don't look like you just come out
Not
of
at
school.
all. I'm
No.
thinking the same thing. Not at all.
Not.
And the decisive nature, the on your feet nature of the emergency room is something that I have enjoyed for many, many years. However, there are other aspects of my life that I wanted to explore. Business has always been very important to me. I grew up in a home with my family. My father was a businessman. And so it's something I wanted to explore. And so after practicing medicine for such a long time, I wanted to go into other areas. And so Whisk and Roll was born.
That's a very different area.
Yeah,
Yes.
very different, very different. Keep in mind, though, that my mother was a homemaker. And so our kitchen was a very busy place. And so cooking, baking, that was a part of my life growing up.
Did you bake?
I'm not a great baker, nor am I a great cook.
I appreciate the honesty, but you have good bakers that work for you now.
Absolutely, I certainly do. Yeah.
She does all of the taste testing. She's very good
She's got
at
it
that.
down pat.
Yeah.
Okay. Now, how do you transition there? How do you transition from being this emergency? What do you call it? Emergency medical physician.
So, St. Thomas Medical Center Freeport is actually a part of a group of medical clinics.
Okay.
And we started in Abaco back in 2012. Our first clinic was Abaco Medi Center, and we served the community of Abaco for 7 years. That clinic was completely destroyed in 2019. We were left with foundation only.
Wow.
Nothing to salvage. So I relocated to New Providence, and we reopened the clinic there under the name St. Thomas Medical Center. A year later, we were able to rebuild our facility in Abaco. And then a little over a year after that, we opened St. Thomas Medical Center, Freeport. Now, as an emergency medicine physician, I I enjoy the interaction with patients. I love to build relationships with my patients, some of which will perhaps last a lifetime. And the ER didn't allow for much of that type of interaction. So over time, I leaned more toward community medicine, general practice, family practice. And so at St. Thomas Medical Center, Freeport, we do quite a bit of general and family practice.
I was about to ask you, what all do you offer at that clinic?
So we see from the pediatric population all the way to the geriatric population.
Really?
Annual physicals is a big part of what we do.
Okay.
Dr. Bowe mentioned that earlier, and that's a very important aspect of medicine. Early detection is key, and we find that we see a lot of hypertensive patients, people who don't know that they're hypertensive. We see patients who walk in because they have a headache and their pressure is sky high. We're discovering a lot of newly discovered diabetic patients.
Really?
We're discovering a lot of HIV. So that annual physical is really important to pick up diseases early and to manage patients accordingly.
So are you a clinic that accepts different insurances and
We
all
do.
of those?
We accept all major insurances. We're also National Health Insurance Authority clinic, so we also accept NHI.
Oh, I like it. Downtown.
I'm telling you, that's amazing. Wow.
That's downtown. Now let's talk a little bit. Let me go. I like food, right? I was looking and sniffing. I don't know which part of the production team had scheduled you for the show, but they neglected to tell you that one of the requirements is to bring Alex some food. But tell me about how it's been having Whisk and Roll open in the city of Freeport. People would say, Freeport is still up and coming and not where it should be. Definitely not as busy as Nassau, but you're clearly doing very well there.
Once I got into Freeport, once we opened St. Thomas Medical Center, I realized that Freeport, despite the challenges that it's had, if you're looking through the right lens, Freeport is filled with opportunities. And so when deciding to open another business was not difficult. Deciding to open another business here in Freeport was not a difficult decision.
You want to say that one more time for the, for the people?
Make sure we capture that, right?
Yeah, we want to make sure we get that. Say that one more time, nice and loud.
Deciding to open another business here in Freeport was not a difficult decision. I found that doing business here in Freeport was quite straightforward. Everything is well structured, and it was an easy decision to make. So Whisk and Roll was opened in February of this year, and it's a family-owned and operated business. We don't just bake cakes and pastries. We offer so much more than that. We wanted to ensure that we offered home-cooked food, quality things, quality products, and we wanted to make sure that our food was authentic and that it was unique. And so when you come to Whisk and Roll, you get that home quality food, right? We offer coffee, we have coffee.
All different types.
All different types, both hot and cold. We also have breakfast. Omelets, breakfast sandwiches. We have whatever you want. In fact, some of our clients would call us and say, I'm coming from the gym. I'd like to have egg whites with spinach and whatever else. So we also offer healthy options, right?
I love that.
Yeah.
Yeah.
So
in a very nice and inviting environment.
So where's the business? Where's the business located?
It's not downtown.
We're located in shop number 11, R&D Plaza.
Okay.
Yeah, where the old movie theater used to be.
It's such a quaint little place.
Right.
When you go in and you just want to sit there for a little while, you want to eat, you want to drink, you want to eat more. I have to say I'm very pleased. I'm very pleased with the establishment.
Okay.
I'm a little biased.
So let's just talk about wellness for just a minute. From your perspective, we've been talking about cancer awareness and all of these things that people would like to know in terms of education. So when we talk about wellness, from your perspective, based on what you've seen over the years, what are some of the things that Bahamians in particular can do? Because we're the ones walking into St. Thomas, right? What are some of the things that we can do to protect ourselves, maybe from hypertension or some of these other cases, maybe diabetes? What can we do?
The first thing is to get checked. Prevention. Come to the doctor, make sure that you get your blood pressure checked, do your annual physicals. Our diet in the Bahamas is really poor. We don't exercise enough. So that's a big part of why we're seeing so many of these diseases that are preventable. So in terms of hypertension, Hypertension is something that in a lot of cases is hereditary in the Bahamas. We have a large percentage of Bahamians who are hypertensive. In fact, it is estimated that more than 50% of our adult population is hypertensive or
So
diabetic.
for those, I'm going to interrupt you, for those who don't know what hypertensive is.
The blood pressure is elevated, high blood pressure.
High blood pressure.
High blood pressure.
They have pressure.
Yes.
Right.
And a lot of times we only discover that a person has high blood pressure when they come in for other reasons. So they might bug their toe and they come in and the pressure is sky high. So one of the things I enjoy about community medicine is that it allows us to pick up things and manage it, things that people may not even know they have. And what we've seen is that we've picked up a lot of cases of cancers, prostate cancer, cervical cancer, cancer of the cervix. Women need to get their pap smears. And so it's important, I think education is really important to let people know that these things need to be checked. You need to come in, see a doctor so that we can check these things. I think the National Health Insurance Plan has helped a lot of people. People who would not normally come to see their doctor, we tend to call our patients and ask them to come in, come, let's check you. And when they come in, we discover a myriad of various illnesses that can be treated. And if we catch it early enough, we can manage it well.
Again, early detection.
Early detection.
Early detection. That seems to be just a general
Yes.
message from everyone that sits at the table during these last couple of
Early
shows that we've
detection.
been doing. Early detection.
Sure.
Education, communication.
Yes.
Early detection.
Now, Mr. Jean-Louis, we talked about just now the fact that Bahamians don't exercise as much as we should. We're hearing about hypertension and things of that nature. How can you help us? We want to talk wellness really with you. How can you help us from the perspective of taking care of our bodies physically?
All right. Well, I think there was a study a couple years ago, some stats came out, and per capita, the Bahamas is the second most obese nation in the world.
A small population.
Small,
of
right.
400,000 people.
Yes.
In the world.
Per capita in the world. And you would think it's crazy, but we have these beaches, we have so much, avenues to work out, but we don't. So yeah, I mean, I'm your guy for that. But like she said, prevention is better than cure. Even when it comes to fitness, what happens is that a lot of people don't start working out until the doctor tell them, hey, you have to work out, right? Whereas if you start to build those habits early on, they play wonders later on in life. So, now I can say that since moving back home, I've seen that there's been a elevation of people working out. In the mornings, I see more people on the roads and stuff. So people are becoming more knowledgeable about it. But we need to do it even more, and we need to share it more to, more exposure when it comes to fitness.
So one would think that, I think for the most part, people think just working out just seems tedious. It seems hard. What are some suggestions that you would give persons who don't do anything?
Right. Yeah, if you do nothing, doing something is better than doing it, doing nothing. And a lot of times people look at the gym, and that's why what we do comes in with the boot camp. Because a lot of people are intimidated by the gym, right? They feel like they don't know what to do, right? So they're timid to go in the gym. Whereas in a boot camp setting, you always have a coach with you. There's a designated workout each day. There's also a community, right, to go along with you, and then it's all fitness levels. But if you're doing nothing, just going out for a walk, right? So maybe if you're a person that you haven't worked out in years, start going for a 30-minute walk each morning.
Walk downtown, Alex. See all of these nice sidewalks downtown?
Yeah,
Walk downtown.
just that. Doing that, doing that a couple times a week, and then as you build your endurance, you go to 45 minutes, then maybe an hour, right? And from there, you want to maybe add some resistance training, right? You don't have to go to the gym. You can just order some resistance bands or a couple dumbbells, from Amazon, or go on YouTube, right? Just do something. Just stay active, and you'll be amazed how much it does for you.
So the name of your business is Sacred and Fit, and I see Mind, Body, and Spirit. Tell me, where does the name come from, and why is it important that you chose that?
I'm glad you asked. But so Sacred and Fit, the overall vision is to have a health and wellness center here, right? To where we can contribute to the overall aspect of the human being, so where mind, body, and spirit. Right now, we're more focused on the fitness aspect with the boot camps, but the vision is to have a place to where you can come, you can work out. There will be a healthy, food spot in there as well. You can do yoga, you can meditate in there. It will just be a place where you can go and just kind of hit every single aspect of our being.
So coming back home and opening up this facility, have you found it to be harder to infiltrate Bahamians' regular everyday routine? Or do you feel that they're more open to you and they're open to now getting involved in the gym and workouts?
Yes, I feel like, once people are knowledgeable and they're they have the right information, they're more accepted of certain things. But now, we have a really good core base of clientele. The more people, and that's where the community comes as well. The community, it allows people to hold each other accountable. So if I don't see you at workout for the week, I'll send a text, hey Alex, I haven't seen you at workout. That'll encourage you to come out. So people are, they're receiving it really well. They're coming out, and it's growing.
Do you see people in different demographics coming out to the gym? I know, I remember when I was living in the U.S., one of the things that I found very interesting was that if you go to the gym, say around 12 o'clock in the afternoon or 11 a.m. in the morning, you'll find some of the older, the elderly persons in the community in the gym. They get to spend more time with the trainers, and they're not mixed in with some of the younger crowds and the more fit crowds.
Yeah.
They have their own kind of time. What kind of demographics do you have, or what kind of demographics do you welcome to come to your center?
So all demographics, and it's mixed for us, right? We have all, I think our oldest client is maybe 70, and the youngest probably 18. The great thing about boot camp is it allows you to go at your pace, right? So you can be at level 10 or level 1. When you come in, you'll go at your pace. And there's, we have coaches to help you out, and as you get stronger, you just keep, increasing your routine. But all fitness levels and all demographics.
So I am one of those persons that I'm very much intimidated when I go to the gym and I see all the fit bodies.
Right.
And they know what to do with the machines. And I remember going to the gym, getting back into the gym, and my trainer would be like, okay, do this. I forgot. I knew I was just here yesterday, but I forgot. It doesn't register to me. Do you have trainers there for people like me?
Absolutely.
Every day that I may need a little bit more assistance, a little bit more encouragement, because I'd be thinking about it.
Yeah, no, absolutely. Yeah, we have trainers, and also it's just people in the gym, that are more advanced. They will help the people, the newcomers. And that's why boot camp, I keep stressing boot camp is so important, because you have that guidance, right? Whereas you go into a typical gym by yourself, you don't have that guidance. You have that guidance, for the whole hour that you're there in class, and also when you leave.
So let's talk costs then. A lot of people think that the gym is very expensive to be able to commit to, especially when right now, everybody is kind of pinching their pocket. They're dealing with the things that are absolutely necessary, and they don't always think that being able to have a healthy physical lifestyle is as necessary. Right. What would you say to the person who wants to be a part of the gym but says, listen, my pocket is small. I don't think I could make it.
Yeah, I would say you could pay a health coach, or you could pay a health bill, right? It's much cheaper to pay me than to pay the doctor, even though,
true.
Yeah, it is. It is a lot cheaper. So, I'd say you gotta make those sacrifices. And I hear people all the time say, hey, I can't afford the gym. But, just say for us, we charge $115 for the entire month, right? And you do based on the sessions, that's about $2 a session, right?
Oh, wow.
Yeah, most women, your hair is what? $2-3 something.
A lot more money.
Yeah, your nails maybe, $100. So I think it's not a matter of we can't afford it. It's just prioritizing, right? And then people don't understand, we don't prioritize our health until it's at risk, right? When the doctor say, hey, you have to work out or else this is going to happen to you, trust me, you'll pay any cost, right? Because you want to live. Right. So I think we just got to prioritize it. And once again, coming back to boot camp. So coming home, I realized, okay, how could, I saw a need for fitness, right? And I said, how can I make this the most cost-effective, but also result-driven? And I came up with the boot camp because you go into the gym, right? You have to pay for a gym membership, then you have to hire a trainer. Right. With the boot camp, you're paying one fee, right? You're paying no gym fee, and you'll have a trainer. You have guidance every single day. So super cost-effective. I'd say for the person that's making excuses, prioritize it. Budget for it, because ultimately, it's going to improve your life.
So how can people register, sign up, become a part of the boot camp?
So you can find us online, and you're online, Sacred and Fit. That's SACREDNFIT, Instagram, Facebook, TikTok. Or you can reach out, send us a message on WhatsApp, 807-5670.
Okay,
5670.
and the times for the boot camp, when does that happen?
5 a.m., 6 a.m., and 6 p.m. So 3 sessions a day. And the great thing about what we do is that when you sign up, you can do a morning session and an evening session. There's no restriction. So if you're like you know, a fitness
So you're trying
fanatic,
to
right? You can
waste
come,
it,
yeah,
just
you can come
go.
all 3 sessions if you want to. No one does that, but
Or just like
there's-
10 minutes in the morning. You got a good 10 minutes out of me.
right. So
Right.
if you want to maximize, you know, your money, you could do multiple sessions.
And I may do 10 minutes at 6 p.m.
That's better than doing
It's
nothing.
better than
We'll see
doing
how it
nothing.
Yeah.
You trying to shade me?
No, I'm just saying. I'm just
Okay,
saying.
but I like that because I
Yes.
work at my pace.
Yes,
Just
ma'am.
like you
Right.
said, I work at my pace, and
Which is good.
I can come to any one of the sessions. All right.
Okay, good. So get started, Alex. Let us know how it goes with Alex. Well, thank you so much. We really appreciate having both of you here. So definitely, Doc, talking about St. Thomas Medical, hearing about the services that you guys offer, and also hearing about the bakery. Alex seems to be a really, really good customer, so I need to come on down there so that I can get my bakery foods on. Let's see what's going on. Yeah, you have a little sweet tooth, you know.
But
I like
remember,
that
you're
stuff.
NHI
So we will see how it
registered,
goes.
so
Yes.
everyone could come in there.
Yes. So definitely we want to thank you, and also, of course, Sacred and Fit.
ma'am.
I believe a lot of people want to be fit, and I think that you're on a journey right now to be able to help many of the Bahamians to be able to get there.
And where are you
Absolutely.
located
So we
again?
want to encourage them.
We're at City of Life, the old
of
bowling alley, right there, easy to find.
Easy find.
Okay,
Yeah.
wonderful. So we want to thank our guests, all of our guests on today's show for joining us. Of course, we're so happy to have them each and every time, each and every week to bring you information so that you can share it with others. Make sure you tell them, check our social media pages so they'll know exactly where to go to be able to get this information,
Right.
whether it be on ZNS, ILTV, Our TV, The Rhythm,
The rhythm.
and we're forgetting somebody, and Dove. And of course,
Just
you can
check
watch
out
it on
the
ZNS
Facebook
Facebook
page.
as well. Get all of that information so that you can be able to share it with others. Alex, wonderful show today.
Wow, so informative.
Yes, yes.
Yes.
So I want to stick a plug in here. I know this is the month of October. We're at mid-month. And we're coming into that holiday season almost. You know, think
Holiday,
about it.
okay.
I'm thinking about. I know the Grand Bahama Children's Home is getting ready to have their fundraiser that's coming up in November. I
That's
believe
right.
that's November 15th.
Yeah.
So we want to tell you ahead of time so that you can get your tickets and be able to support the Grand Bahama
We
Children's
need to
Home.
have them on the show to talk about this
Oh,
event.
absolutely. So we'll extend that invitation so that we can find out
There you
what's
go.
going on. I believe the theme this year is Casino Royale.
Oh. Oh.
Very, very nice.
Sound like feathers.
And so we want to call out Corporate Grand Bahama, all of the private companies, everyone, please come out and support the Grand Bahama Children's Home. Reach out to them so that you can get your tickets. We love our children.
Now, coming up the holiday season.
Yes.
What else is happening for holiday season?
Well, you
Anything
know,
special
down
for the
in
show?
December, there's Festival Noel. We also have
Freeport Flash
Friday,
Friday,
and I know
Midnight
that we have the
Madness.
4 Fridays and Midnight Madness and all of that good stuff. So we're going to be sharing that stuff with you, but we gotta go. I'm so sorry, and we love
should
to
have
be
a
with you, but we have to
Thanksgiving
go
show.
today. Well,
With turkey.
so you can eat. I know you
I
were
have to
going
talk
say
to
that.
production team about that.
But anyways, we will keep you guys posted on what's happening, and as much as we get the information in, we're going to put it out to you. I want to say a very special happy birthday to my son, Lamaj Khalel. Happy birthday.
Happy birthday.
Looking forward to celebrating with you. And on the very next day, my son's on the 15th, mom's on the 16th. So,
Happy birthday,
mommy,
Mom.
happy birthday. Gwendolyn Sands, so happy to have both of you in my life, and I hope both of you have such a wonderful celebration on your birthdays. Alex?
Lamaj, I come up for some of your cakes. I know Mommy getting you cake, so she's giving me no cake.
No, I won't give you any cake, but I'll share some of his, okay? No problem.
Yes, awesome show.
All right, so thank you guys for inviting us into your offices, your businesses, and your homes. Grand Bahama's best talk show, Focus Forward, is always here for you. And until next time, I'm Glendia Sweeting.
And I'm Alex Thompson.
Informing you on the positive things that happen when you focus forward.
You've been listening to Focus Forward, sponsored by Invest Grand Bahama. Like us on Facebook at Invest Grand Bahama Small Business Bureau to stay updated. And drop a business card at the Grand Bahama Port Authority receptionist desk to have your business featured on our show. Tune in next Thursday,
Same time.
same place,
For Focus Forward.